Hello, everyone and friends. I always, when I came here and I was asked this morning, don't be too nervous about talking. I said, oh no, these are my homies. I'm just so pleased to be here. I know so many of your faces and new faces, and wonderful to connect, after our last few years. So to be able to see some of you in person, give you a hug, was lovely. I also, though, want to formally acknowledge the traditional custodians of the land. We're here on Gadigal land of the great Eora Nation, and to pay my respects to elders past, present and emerging. And as Tim has said, in that acknowledgement is to really also pay respect to their custodianship for thousands of years, a benefit that we realise when we may not even realise that. And for me when I reflect upon that, and you can go for a walk and you may not see the shape of the country or the footprints, so to speak, of our Aboriginal custodians. And the team and I went for an Aboriginal guided walk around Barangaroo, and just to learn about the history that is right on the doorstep of Sydney. I just would invite everyone to go and do that. I think sometimes we may think that that Aboriginal history is somewhere else. It's, where there are trees and rivers and fish ponds, but it's all around us, and I really want to acknowledge that, and to acknowledge lived experience, which, as Tim says, is at the heart of how the Commission works. It's the lens that we run over everything. It's the way that we believe not only do we get the energy in our work, but it's how, when we have a job that's about changing and reforming mental health, systems, services, models of care that cannot be done without people whose services that we are planning for are done together. And so for us, it's not only about acknowledging lived experience, but acknowledging co-design, how we walk this journey together. Today, I will be reflecting upon the importance of peer work and the future of this crucial workforce. And I guess for you are always the experts. It is a bit intimidating coming to talk about peer work when all the experts are in the audience and you're just here thinking, well, I hope I can make a positive contribution. And of course, I will also point out that I've got the wonderful Tim sitting over there next to the wonderful Heidi, next to the wonderful Daya. And in my role as Commissioner, it is so important to have people like you three and many others in this room who've either worked at the Commission or participated in our work. I'm just here as one person, but we are many, as I think the song says. So, since, I think, I might have one more, click. Thank you. Since its inception, the Commission has been right behind the support of peer work, as we are committed to amplifying the voice of peer lived experience in all we do. We know that people with lived experience of mental distress hold expertise that is incredibly valuable. Peer work roles like yours are integral to the concept of lived experience at all service levels, including peer support to people with a mental health issue, peer mentoring and peer leadership. Peer workers are a living embodiment of recovery in action. You role model recovery and provide hope as you walk alongside consumers and help navigate the system and services. The employment of peer workers drives change towards more recovery-focused and trauma-informed organisations and away from that purely biomedical model. We know that the research shows that it improves recovery outcomes. It role models recovery and provides hope. It reduces hospital readmission rates, and helps people engage and re-engage with community mental health services. It helps people engage with their own community and supports. It improves experiences of services and it supports positive therapeutic relationships between consumers and other mental health staff. That's, I think, really important. It's the collective action there, whether you're on an inpatient unit or wherever. It's about how we all come together. Peer work can also offer a career pathway, offering something more than just a job, but something meaningful to do, to be able to use one's own lived expertise to assist someone who is experiencing something you've also experienced yourself. How can peer work help in all aspects of a person's life? Well, we know with the rising cost of living and the lack of social and affordable housing, it's having an impact on people's mental health. And as Michael said earlier, we know through the period of the pandemic and all the trauma that communities experienced during the natural disasters, a lot of people's mental health has declined. And what we found in a commission survey is that people also who had mental health issues before the onset of all of those disasters, that their mental health declined even further. And that kind of just makes sense, doesn't it, when times are tough. So therefore, having access to good quality, affordable housing is a fundamental thing to well-being. It can help reduce poverty and enhance equality of opportunity, social inclusion and mobility. Recent research by Reach Out shows that stress about the cost of living and stress about the future are both in the top 5 most concerning issues for young people. Of the young people who identified cost of living as a major concern, 40% said the cost of living is having a major impact on their mental health. Additionally, over half of young people reported challenges around their sleep and mood changes due to these cost of living pressures. We know that crisis support and suicide prevention services have seen an increase in people accessing their supports. Lifeline is answering almost 500 more calls each day than during the same period 4 years ago, with, again, financial stress as a key concern raised. Peer work plays a huge role in supporting people in crisis, as we know that peer workers provide hope, serve as a living testimony for recovery, and link people with the right support at the right time. Economic pressures mean peer work programs in the housing and homelessness space are critical right now. Flourish Australia has funded peer work positions in the New England Regional Sustainable Housing and Homelessness Program, and St Vincent's Hospital Homeless Outreach Team also employs peer workers to help navigate services and provide support. Peer workers under the Pathways to Community Living initiative are also crucial to helping people transition back to living in the community and liaising with housing providers. So while there are specific needs for each sector, peer workers employed across the public health and community managed sector have a shared peer work identity and way of working. It is this shared connection that will help break down siloing in mental health and create productive partnerships between organisations. Peer workers can play an important role in the provision of warm handovers across the system and through your peer networks. Peer navigation of services and supports can be strengthened by peer workers. They work adaptively across New South Wales Health, the community managed sector and related services and community supports. It is important that peer workers have the opportunity to network with each other at events just like this forum, so thank you, Being. I can see the forum supporting partnerships and knowledge sharing that will ultimately benefit people with a lived experience. So, where does the future lie? Peer workers have unique expertise that can be transformative for people who access services, their families, their carers, and their mental health services and systems overall. The peer workforce has come a long way, but of course there's always much work still to be done. To achieve a recovery-oriented system of mental health and social support, we need peer workers in that system. We need peer workers to provide peer support and advocacy to consumer and carers. We need peer workers to participate in quality improvement and evaluation. We need to adopt co-design and co-production as business as usual. in mental health and social services. We need peer workers in policy and planning roles. We need peer workers in management positions and working as system leaders. We can only achieve this if we have a coordinated response across the system to allow for more peer work, student placements and traineeships. We focus on building the capacity and skill set of peer workers to meet projected needs, including access to peer supervision. So in this, the Commission is a partner, an advocate, and it's Monday morning still, an advocate and a supporter. The Commission has identified the peer workforce as a priority area to support reform, and we will continue to advocate for the voice of lived experience in all of our work. In the Commission's 5-year strategic plan and the program of work that sits under it, there is a priority on embedding lived expertise and elevating lived experience leadership. The Commission values the voice of people with a lived and living experience and employs several staff in designated roles, such as the new Senior Advisor Lived Experience position, aka DEA. Welcome, welcome, welcome. We also have Deputy Commissioners and our Community Advisory Council. Now, it does look like that table was set up for this speech. I wonder whether they did do that on purpose. I don't know if Melody is here or Ben, but they are also on our Community Advisory Council too. Additionally, the Commission has led and funded a number of projects and programs in the peer workspace. We also work to listen to the peer workforce and our peer work advisors, along with our Community Council, Deputy Commissioners, being and mental health carers, to advocate to support the peer workforce, whether it be through promoting mentoring or professional debriefing, supporting the professionalisation of the peer workforce, as well as looking at the curricula of the Certificate 4 to see where we can strengthen the capabilities of peer work as identified to us. Slide. So I just want to give a couple of quick examples of how the Commission has worked with lived experience, with peer workers, and to herald, I suppose, also the direction which we also want to continue. So one of our projects is on peer navigation. So the Commission identified through community consultation that peer navigation is a key enabler of lived experience-led, joined-up system of support for people living with mental health issues and their families and carers and supporters. Over the last year, we have partnered with 4 organisations to pilot peer navigation models in unique settings with tailored service models and target groups. We'll be releasing a report shortly which highlights the fantastic outcomes of pilots in rural communities, busy emergency departments, LGBTQI+ services and Aboriginal communities. We envision these pilots will help build the business case for ongoing employment of peer workers in peer navigation. Over the next year, we'll be collaborating with the Mental Health Coordinating Council on the development of a nationally recognised peer navigation unit to sit alongside a Certificate 4 in mental health peer work. We also have our peer work hub, and it's fantastic that Sage Green is here, the initiator of our wonderful peer work hub. Thank you, Sage. And the peer work hub hosts resources to support New South Wales organisations to develop their mental health workforces. These resources guide employers on how to start or to grow their peer workforce. We also are partnering with SANE to have a peer guide pilot program for New South Wales in which participants complete a 10-week online training module, participate in one-to-one peer mentoring and group mentoring sessions, and undertake a 10-week volunteering experience in the SANE forums to support their transition into peer work. And finally, as you know, the Commission also has funded 100 peer work scholarships that we've been working with the Mental Health Coordinating Council with. And also the Commonwealth Government approached us about auspicing their funding for additional peer work scholarships in New South Wales. So we have found that these also have rolled into our work, not only with the Mental Health Coordinating Council, but also we've worked with the Health Education and Training Institute about supporting that. Health Education and Training Institute provides training across all of our health workforces, and I sit on its governing council. And one of the key things for me is to get peer work into their thinking and peer work into how they understand that when we look at collaborative multidisciplinary teams, that peer work is a part of that, no negotiation. And I have to say that Hetty are very open to that as well, which is also fabulous. So as part of this program of the funded scholarships for lived experience peer work to undertake the certificate for, that's free education, and we are so happy to support that. But I think we really want to also ensure that certificate for are taught by peer workers in New South Wales and offers other new career opportunities for the peer workforce. So it's not only about understanding how can we grow the peer workforce, but to then use that expertise back into that education. So finally, I do want to thank Being Mental Health Consumers and the New South Wales Mental Health Consumer Peer Workforce Committee for inviting me to speak to you today. It is always a privilege to come and share with you not only the passion and the commitment of the Commission, but also to be with people who are likewise passionate and committed to peer work. We are all here to improve the mental health and wellbeing, to have enjoy good health for everybody, to have parity of access to services like the rest of the community, so people can live on their own terms, to have choice about their lives, and to feel that their life is as equal and as valuable as everyone else's, which of course it is. So congratulations on your 30 years as well. Thank you.